Tiffany Kittle, and welcome to Listen Up. Today my co-host Jillian Haypack will be speaking with Wendy Kramer, a psychologist from the Renfrew Center in Philadelphia, and later we'll have a discussion about eating disorders with a few students from NAHS. Wendy received her master's degree in counseling psychology from Temple University, has worked in the healthcare industry for over 20 years, and has been at the Renfrew Center since 1992. She is currently a professional relations representative. Eating disorders like anorexia, bulimia, and binge eating are becoming increasingly prevalent through Western countries. According to the U.S. estimates from National Institute of Mental Health, between 5 and 10% of females and 1 million males suffer from eating disorders, including anorexia, bulimia, binge eating, and other associated dietary conditions. Estimates suggest that as many as 15% of young women adopt unhealthy attitudes and behaviors about food. Because of guilt and consequent secretiveness about eating disorders, it is likely that many instances go unreported. Therefore, higher incidences of eating disorders is almost certain. According to studies into diet, weight loss, and body shape, many individuals feel dissatisfied with their body shape and develop subclinical and/or borderline eating disorder attitudes and behaviors. For example, 80% of American women claim to be dissatisfied with their appearance and shape, and 1 in 2 American women are on a weight loss diet. The prevailing standards of body, weight, and shape, as revealed in the use of abnormally thin models in the media, continue to emphasize the idea that thin is beautiful. Now Jill will speak with Wendy about eating disorders, and coming up later, we'll have a discussion with some NAHS students.
Hi, I'm Jillian Haypack, and I'm here with Wendy Kramer, who is a professional relations representative for the Renfrew Center. Today we're going to be discussing eating disorders. Thank you for being here.
Thanks for having me.
Yep. Okay, let's start off by you describing to me what the different types of eating disorders are, the main ones that we see the most. Could you give me a description of them?
Sure. Well, at the Renfrew Center, we work with anorexia, bulimia, and compulsive eating or binge eating disorder. And anorexia is probably the easiest of the eating disorders to recognize, and that to be diagnosed, you have to be at least 15% below an ideal body weight. Women will lose their period for at least 3 consecutive months without being pregnant, of course. That actually is going to put them at risk for osteoporosis and bone loss, which surprisingly can happen in young girls as well. We treat women from 14 up at Renfrew. There is no upper age limit, and we're seeing more and more women in their 30s, 40s, 50s, 60s, even 70s coming into treatment. But we do have many young women, 14, 15, 16-year-old girls, with full-blown osteoporosis. So it's pretty scary. Actually, some of them need to be in wheelchairs just to get out of bed because they're at risk for stress fractures from losing their period. Other symptoms of anorexia will include this very distorted body image. If you've known somebody with anorexia in the past, you'll know that she'll probably talk about how fat she is. So she will see herself in the mirror as a very large person, even though you see her continuing to lose weight and her bones are sticking through, but she doesn't see herself that way at all. And nothing you can say is going to change her view of how she looks. That's part of the disorder talking. Also with anorexia, women and men tend to withdraw from social situations. They don't want to be around others because there's usually food there. So it's easier to just stay away from that.
Isolate themselves.
Isolate themselves rather than make excuses all the time as to why they're not eating, because people tend to catch on after a while. Also with anorexia, we see a lot of intolerance to the cold. Women are cold all the time. Makes sense, they don't have enough body fat to keep themselves warm. So they may actually wear lots of layers of clothes, not only to keep themselves warm, but they may be trying to hide how thin they're getting from their family and friends. We also see many times the hair on their head starts falling out in clumps, yet they may grow what's called lanuga, which is a fine downy growth of hair on their face or their arms. And again, it's the body's reaction to starvation. It's trying to keep warm so it'll grow more hair. And I don't think any young girl wants to have hair on her face or lose the hair on their head. Now, the most important thing to remember about anorexia is that up to 20% of women with the disorder may die from it or its complications. So that actually is the highest death rate of any psychiatric disorder. It's a pretty scary number.
Can you tell me about the bulimia and the binge eating?
Sure.
Well,
bulimia is generally categorized by eating in an out-of-control way, and often it's more than a normal amount of food, sometimes not, and I'll talk about that in a minute. And then purging or getting rid of the food. So it's a binge followed by a purge. And that is out of control behavior. They can't stop the eating, and they can't stop that need to get rid of the food. So some ways that we hear about that are common ways of purging are things like vomiting, laxative abuse. We see an awful lot of laxative abuse at the Renfrew Center. The other ways of purging may include diuretics or diet pills, enemas, and certainly exercise is one that we're seeing quite a bit of. Exercise is a way of getting rid of the calories that someone ate in a binge. With bulimia, they can be a normal weight, they can be above a normal weight or below. So it's harder to tell if someone, you can't assume anything by looking at them.
Okay. What about the compulsive eating?
Or binge eating disorder? Sure. That's categorized by binging or generally eating a larger amount of food, but they don't necessarily purge or get rid of the food. With that population, we oftentimes see a lot of dieters that have tried all the diets that come into the media, and then they may lose weight initially, as many people do when they first start to diet, but as most people do when they diet, they'll gain the weight back and more. So they've put themselves at risk for, first of all, lowering the metabolism, and if they are above a normal weight, and unfortunately with the dieting behavior, they tend to stay at a higher weight because they gain back more weight, they're going to be at risk for high blood pressure, heart disease, diabetes.
Okay. Can you tell me some of the statistics?
Sure. It's estimated that about 10 million people in the United States are struggling with eating disorders. Of that amount, between 90 and 95% are women. So we do see men at the Renfrew Center only on an outpatient basis. But in any of our other programs, including our residential programs, our partial, our intensive outpatient programs, we will have that as women only in those programs.
Okay. You said a little bit earlier that bulimia is described as the binging and then the purging. If someone's not binging, they're just eating a small amount of food and then making themselves throw up. Like it's not an outrageous amount of food. Is it still considered bulimia? Absolutely.
In fact, I've assessed patients who've described a binge to me as enormous amounts of food. I had a patient who I assessed once who talked about eating frozen food out of the freezer, not defrosted. So you really get the sense that this is not about being hungry and filling yourself and then stopping when you're full. This is out of control behavior. On the other hand, I've assessed patients who've talked about a binge as eating 3 bites of chicken. But that still felt like a binge to them. They ate that in an out of control way. And most importantly, to fit the criteria of bulimia, they had to get rid of it. They had to purge in some way.
Okay. Do you consider eating disorders like an actual illness that can be genetic, or do you consider it something that is developed through society, or is a mental disorder?
Well, that's a great question, and I think a little bit of both. There is, the Renfrew Center is now involved in a national study about possibly there being a genetic link with anorexia in particular. So there is that feeling that there may be something. Certainly anecdotally, I can tell you at the Renfrew Center we have treated many mothers and daughters, of course not at the same time, sisters, cousins, aunts. We do tend to see the eating disorders running through the family line. On the other hand, I think the media and the culture has an awful lot to do with why so many women in particular have developed eating disorders. The messages that we're bombarded with from the time we're quite young. And interestingly enough, we're seeing more of those advertisements aimed at men as well. And as that changes, we hear from more men about seeking treatment for their eating disorders as well.
Okay. How do you detect an eating disorder amongst your family or your peers?
Well, there are certain things that you might look for. Certainly some physical signs if someone is vomiting as a way of purging. A few things you might want to notice, but don't make any assumptions. If someone's always using the bathroom after eating a meal, whether they're eating more than normal or a normal amount, again, don't assume anything. But if you happen to go by the bathroom door and they're running the water in the sink or the shower's running, or they may be blasting the radio. They may be trying to cover up the sounds of the vomiting. Obviously, if you find vomit in the bathroom or smell that, it's a pretty good sign that something may be going on.
Yeah.
If someone's exercising in an out-of-control way or hiding how much exercise they're doing, that may be a sign. Some physical things you may look for. If someone is vomiting as a way of purging, they may have cuts on the side of their mouth from their mouth opening so wide. When they vomit, they may have swollen glands here. They may have bloodshot eyes. Also, they can have cuts on their hands or calluses from shoving their hand down their throat to induce the vomiting.
Yeah.
And oftentimes the dentist may be the first one to notice that someone's bulimic if they're vomiting, because the stomach acid gets worn away by, the tooth enamel gets worn away when the stomach acid comes up.
Yeah.
So those are some things to look for. Also, if someone's withdrawing, they don't want to be around others, especially around meals, that might be a sign.
Okay. As a sister, as a friend, what can I do to help somebody that I notice that's close to me and that I care about that's going through this?
Well, it's probably one of the hardest things you'll ever do in trying to approach someone with an eating disorder. I think most importantly, you need to approach them in a very calm and respectful way. You want to do it one-on-one, not surround them with other people and have them feel ganged up upon. And I would really recommend not focusing on the symptoms, their body, their weight, their appearance, and your body, your weight, anybody else's appearance. Don't make comparisons. Don't focus on how thin they're getting, because that's really feeding into the eating disorder. So to say something to your friend like, I'm really worried about you're getting too thin, you've just given them the biggest compliment. And that's really going to encourage them in their eating disorder, because they're thinking, someone's finally noticing. I'm going to show them I can be even thinner.
Okay.
Instead, focus on feelings, what you've noticed, like, I see you don't ever want to hang out with us anymore, you never want to go out, or you seem down, I'm really worried about you. That's a better approach, because it leaves the opening to what's really going on for them. Don't assume that they're going to come clean and tell you everything. Most likely, when you try to approach someone, they're going to be very angry at you. They may be in denial. They don't want to give this up. For many people, they feel like this is the only control that they may have. So it's going to be very hard for them to just say, yeah, I need some help. It can happen, but most likely they might be angry. What I would recommend is saying to them, I'm really concerned. I know you're mad at me right now. I don't want to lose you as a friend or a sister or a mother or whatever.
Care.
I care. And I hope that you can help. You can realize you need some help, and I'd be happy to help get you to some professional help. You can't fix this yourself. No friend can do that. But you can help them use the resources that you have, like your counselors at school, like the nurses, like any staff that you feel comfortable with, adults, whatever. Get them to someone who can show them there are places to get help. And the Renfrew Center has a website, and we have lots of information that's available to help people get treatment, because it's so important to get someone into treatment as early in the process as possible. You have a much better chance of getting being successful in treating the eating disorder if you're able to make an intervention early in the process.
Okay. Well, thank you so much for your time. I really appreciate it once again for coming out.
Thank you.
All right. Thank you.
Hi, I'm Tiffany Kittle, and I'm here to do the Teen Talk with my co-host Jillian Haypack for Listen Up. Jill, you want to start us off today?
Sure. Today we're going to be talking about eating disorders, what they are, how to detect them, and what to do if you see that your friends have eating disorders. Let's start off by talking about what you guys think eating disorders are.
Well, I think an eating disorder is someone who eats too much or not enough because they're self-conscious about their body image.
That's a really good idea about what eating disorders are. The three main types of eating disorders are anorexia, bulimia, and binge eating. And anorexia is when you don't eat enough and when you eat a tiny little bit when you do eat. Bulimia can be categorized as when you eat a whole lot and then you make yourself throw up to get rid of it, or you abuse laxatives to get rid of it. You do something to get rid of it really fast. And binge eating is when you like never eat, but when you do eat, you go crazy and eat a large amount. Have you guys ever noticed anybody with weird eating patterns?
Yeah.
Do you want to talk about it?
Yeah. One time at lunch, I saw this girl, and she never ate ever at lunch.
Do you think she could have an eating disorder?
Maybe.
Maybe. Like, what would you do? What can you do in that situation to help somebody who has an eating disorder?
I think I would just try to comfort them as much as possible and see what the source is. Try to get them off of that as soon as possible.
The source of, like, their problems?
Yeah, like why they're eating so much or why they're not eating at all.
It's always kind of a risky situation trying to like talk to someone about it though, because they might not even be like anorexic or have an eating disorder. Like they might like, there's this girl that I know who I always used to think had like an eating disorder because she was like really skinny and really like kind of sickly looking. But later I found out she had like a breathing problem, and like for whatever reason like she just barely ever gained weight, and she's like still to this day like really skinny. And like, I always thought she had an eating disorder, but apparently it was like a disease that she had. So
what do you guys think causes eating disorders?
It's a bad body image.
Bad body image?
Self-consciousness.
Really?
I think it would be just someone not getting satisfaction from another aspect of life. So they turn to eating or not eating.
To
a
try to
substitute.
control or gain control, maybe. Yeah, those are all good thoughts. What else do you think is important to know about eating disorders?
I think it's important for people to know that an eating disorder isn't just something to do with the person like saying, well, I'm fat, so I'm just gonna stop eating. It's like, it's actually a disease.
Deeper.
Like eating disorders are a disease. It's not like just a mental outlook on your life in that I eat too much food, I need to stop. It's kind of like an obsession with wanting to be too thin.
Yeah. Also, like, if they feel like it's, their life is out of control, they, what else can they control besides, what
Besides
they
their
eat,
weight.
what goes in their body and their weight. Let's go back to what you can do for somebody who has an eating disorder. Do you guys think it's appropriate to seek outside help?
Yeah, because like it has to do with their health, and that's really serious. So you have to get other people involved so they can help them.
Should make sure they have an eating disorder first, though, because
Yeah,
you
before-
confront
that
them.
might be really embarrassing to you and the person that you're confronting about like having an eating disorder. If like I just talked about, like if
Serious.
it's actually like not eating
breathing
disorder,
problem
but
or something.
yeah.
Probably embarrassing for them too, to have people think that they have an eating disorder if they don't.
So let's get in a situation where it's confirmed your friend has an eating disorder, it's your best friend, and it's really serious, and they never eat, or they make themselves throw up all the time, it's out in the open. What do you do?
I think I would open up their views to other ways of being happy or just getting self-satisfaction, showing them that they really are great people.
Yeah. There's a certain point where that might not be enough, though. Sometimes you have to think about therapy or, talking to their parents about getting them some clinical help, like a rehab center, like the Renfrew Center. We interviewed a psychologist from the Renfrew Center, and they do all types of therapies and that sort of stuff to really rehabilitate people and help people out that have these problems. So that might be a good idea, something good to think about.
I agree. I think therapy is definitely a good thing if you have like an eating disorder, especially if it's getting like out of control. Like when things start out, I mean, like they're serious. Eating disorders are always serious, but when you start out with an eating disorder, it's not that like obsessive compulsive type of disorder yet. Like
It's
you're
always
just
the
starting out, like it's not as bad as it like can possibly be. It's like, well, I'm just gonna skip lunch today because, I'm trying to lose some weight. And then eventually it'll get to, well, I'm just not gonna eat anything and I'll just drink lots of water and exercise like all day.
Yeah, compulsive exercise. Yeah, that's also another crazy thing. People will exercise and 3 sweatsuits at a time for 3 hours run on the treadmill. That's, that's too much. That's crazy, and you got to know when it's too much. So those are some really good thoughts about eating disorders. Thank you guys so much for coming out. I really appreciate it. Stay tuned next time. We'll be talking about parenting.
Hi, I'm Tiffany Kittle, and today I'm here with Miss Brumball, one of the nurses at NAHS, and she's going to answer a few questions I have for her. How are you today?
Good, Tiff.
Okay. Is there a period of time that a student can't return to school if they have like an eating disorder? Like, is there any type of process they have to go through, like with therapy, and then they're allowed to be back in school?
There's not a set period of time. It would really depend on their doctor or facility if they were hospitalized. There's many different scenarios. First of all, if the student's been hospitalized, we would expect some kind of communication between the family and the school that would be kept confidential as to when they felt the student was able to return to school, physically and mentally able to return to school. And also we would ask for some kind of a doctor's note saying that the student is physically and mentally able to return to school. But we don't keep them out for any set period of days or time. It's individual and when they're ready.
Is there any type of approach that a friend might give to one of their friends that had an eating disorder that you could think of that would be a good idea?
Mm-hmm. I think if it's a friend that you recognize might have a problem, you have a good open relationship with them, is to talk with them about it and to say, hey, I've noticed this or I've noticed that, and it's bothersome to me, and I really care about you. How can I help you? And sometimes it's a relief to that person to have that out in the open. They've been hiding their behaviors sometimes for a really long time, and just talking with a friend brings an overwhelming relief to them. It's difficult for a student or someone young to steer them in the right direction and get them the help that they need. But certainly you can encourage them to maybe talk with their parent or talk with a teacher that they trust, their counselor in school, or one of the nurses, so that we can help guide them to the support that they need, or to their physician or whatever. But I think that's important, that you have a relationship with somebody and you're close with them, that you're able to talk with them about it and help them, and then you're their support system.
If there was a student that came to you that had a problem and they thought that they might have an eating disorder, what would be your advice to them?
I would first sit down and talk with them about it and ask them what makes them think they might have a problem, or what makes them think they might have an eating disorder. I'd ask them maybe about some of the behaviors that they're exhibiting, or and then I often encourage them to talk with their counselor with me, because if we work in tandem, the nurse with the counselor, we can approach that from the medical point of view and also the psychiatric point of view, support point of view. Keep some books in school for caregivers, such as parents or a student to read, and they can look those up or borrow them from us. These are great resources for young teens, especially, that might be having a problem or might have a friend that has a problem.
So do these books, I'm not sure if you've read any of them, but do these books tell you what things to look for, if you think you have an eating disorder, or
Yes.
what things to do if you're trying to overcome an eating disorder?
Yes, it does. It gives examples of the different behaviors that are involved in eating disorders, such as the binging and purging. It also goes into what happens if I have a friend or a family member that I think has an eating disorder. It goes into that. What happens if I have a child? So sometimes parents would borrow these books from us if they think their child is having a particular problem. There's also some really great websites that I refer students to, that they can go to for support, and also to read about what's all involved with eating disorders. It's a very complex thing. It's not an easy thing. It's not something that we could look at somebody and say, well, you've got an eating disorder and this is what we're going to do. It's very, very involved, and it's a long road to recovery for that person. But I think by them first recognizing that they have a problem, which sometimes they can get that answer by reading some of the resources we have, then the next step is for them to, after that realization, is to get the help and treatment that they need.
Now, I've heard that an eating disorder isn't just like a state of mind, it's like an actual disease. Is there like any type of counseling that you would suggest like
Well-
for someone who had an eating disorder?
Well, it becomes a disease because they sometimes are not well from that. They end up being dehydrated, have poor nutrition, which affects a lot of things. You know, affects your skin, your hair, and the way you look, your teeth. So it is a psychological disease, as well as sometimes it ends up being a physical problem because of the way your body is reacting to the lack of nutrition and so forth.
Is there anything specific to look for, like with someone that you might think has an eating disorder, like lack of eating, a lot of exercise, a lot of drinking of water?
Yeah, they're the more obvious ones. Someone that is just overly concerned about their weight, or even to the point where they have an obsession about their weight. Someone who is maybe not comfortable with the way they look and make comments. I mean, we as women, we are never comfortable with our looks. Most of us are not comfortable with our looks. But someone who is overly obsessed about it, you know, talking about it all the time, or looking in the mirror, or weighing themselves a lot. Someone who gets up from eating maybe at the lunch table the same time every day and leaves to go into the bathroom because, you know, they're going to vomit. If you're with them every day, you sort of know their habits, and if you see that happening to somebody every day, that would be a red flag for me. If the girl is getting up from, or a boy is getting up from the lunch table and leaving at the same time every day after they've eaten lunch, you could suspect that they were maybe bulimic. Not necessarily somebody who's really, really thin. You know, that's sort of a stereotypical, what's the word I'm looking for? A stereotype. But those are some of the main ones.
Okay, well, thank you so much for your time.
You're welcome.
And back to the show.